Hi, I'm Gary White for Channel 6 Central Kentucky Television. I'm here with Dr. Johnny Isaacs with Isaacs and Isaacs General Dentistry on Bobolink Drive in Springfield. And today we are going to talk about some of the jargon that you hear when you're at a dentist's office, right?
Right. I thought I'd kind of give a little bit of the behind the scenes, what we talk about. I was talking to a few people the other night. I was at an investment club, and they started asking about the numbers, and then my wife was asking, wanted to know what the numbers meant, and I thought, it'd be a good little segment. So I think it'd be fine.
Because each of our teeth has a number, right?
Right.
Okay.
They all each tooth. There's 32 teeth, and they're each numbered, but we don't look at them as numbers per se. We look at them as names. Like if we say tooth number 3, we don't think of it as being in front of 2 or behind 4. It means a first permanent molar on the right side. So all the molars are 3, 14, 19, and 30. So just over time we've kind of developed that. It's more of a name to us. But we use the numbers when computers came in vogue. We had to switch from a different system to a number system so that we had to go back to the old system because they had numbers. Before we just had symbols and so the computers weren't understanding the symbols. So we went back to the numbers. So this has been a way for a long
They're
time.
kind of like prints. They went from prints to the symbol and back to print.
Exactly. Yeah, that's a good way of putting it. So if you can, I've got a skull here that we can kind of illustrate what we're talking about. So the teeth go from 1, that'd be the upper right wisdom tooth, all the way to 16 on the top. So the 2 wisdom teeth are 1 and 16.
Okay.
And then it goes from 17 to 32 on the bottom. So if you took out number 4, it'd be 1, 2, 3, 4 is right there. 4 is a premolar. And even if the teeth, excuse me, even if the patient doesn't have the tooth, you still have to count it because, like I say, the teeth don't mean anything chronologically to us. It's a name of the tooth for us. So if we say we're going to take out tooth number 4, even though there's no teeth behind it, it's not number 1, it is 4 because we're talking about a maxillary right premolar.
Okay. So everybody has 32 spots for
32
the teeth.
spots, exactly. That's what.
Whether they had the teeth or not.
Right. We still count them. And even if you have your wisdom teeth taken out, then we still have to count the space. Exactly. So it's good. Some people have more than 32. Certain people have it. Certain races have it more than others, and males have it more than females. You'll have an extra wisdom tooth. So we call those we'd call that if you had an extra left mandibular wisdom tooth, you call that 17A. We just give a letter after it. So instead of giving it a number, because there's no spot, there's no number spot for it, we give it a A, B. Right. So that's how that works. So and then the primary teeth, the baby teeth, we use letters for them, and that goes from A to T. So there again, A doesn't really mean anything. It means maxillary right second molar for that. So it goes from A to T. So baby teeth, there's only 20 baby teeth, but there's 32 permanent teeth.
And do all 20 of your baby teeth fall out at some point?
They all fall out at some point.
Okay.
They usually come in at age 6 months to 2 years. You get your 2-year molars, which would be A. Let's say that'd be A, J, K, and T would be your first molars. So I'm sorry, those are the second molars. They come in at about 2 years.
Okay.
2-year molar, and they leave depending on usually females. Girls will lose them before the boys. About 9 or 10. Boys about 12, 13, sometimes 14 will lose all their baby teeth. So that's why it's kind of delayed. You have more time if you're worried about orthodontic intervention for braces. You have more time for a boy than you do with a girl. So girls, you want to catch them a little faster.
Okay.
So so you've got to be a little more aggressive on the females.
But all those teeth will eventually fall out, and then they are replaced by
the permanent teeth, the succedaneous permanent teeth can replace them. But you have 32, so you have 32 teeth replacing 20. So as the jaw grows, you'll have more room in there. So there's more permanent teeth than there are baby teeth.
Interesting.
Yeah.
So do the permanent teeth grow where the baby teeth fell out?
Yes.
So they just fall out.
They push them out. They push them out. They go to we call it the buccal, which means the outside. They go on the outside of them. Buccal is a term we use from, it literally means mouth, I think the Latin, which would be boca. So what it is the, from the buccinator, which is the muscle of the jaw. So it comes from buccal. So now we have 32 teeth, and we have surfaces on all those 32 teeth. So you'll hear us talking back and forth, like we'll say DO on number 5. A DO would mean tells us that there's a cavity on number 5 tooth, which is a premolar, and the surface is the DO, which would be the distal occlusal, which means the top and the back. It kind of tells us where we have to go to get to the cavity.
Okay.
So we'll say, we just use the a DO. Sometimes we use an MOD, which would be the mesial occlusal distal of number 5 if you're doing that. So we say that's an MOD on number 5. So that's kind of how that's the jargon. We're yelling back and forth at each other. No, we don't yell, but that's kind of,
you're talking
when I walk in there, I say, what are we doing on Susie today? They might say, well, you're doing a FIL on number 8. FIL would be facial, incisal, lingual. So it's those more words coming in there. Facial on the front teeth, we don't use buccal because there's no a buccinator muscle over top of it. We use facial. Incisal means the top part of the tooth, and lingual refers to the tongue side. So it'd be an FIL on 8. So it's kind of what you hear back and forth.
Huh.
And there's certain words we try not to say. Those things we kind of say openly, but there's certain words we try not to have the patient hear. So since we're talking behind the scene nomenclature and jargon, we use, instead of saying blood, we don't like to say blood in front of the patient. If something's bleeding, we don't say it's bleeding. We say it's hemorrhaging. Sometimes that sounds worse. But like a child won't know it,
right.
But he'll know. So we said we got a little hemorrhage on tooth, so we don't say blood. It kind of scares the children. And we don't say drill. We never say the D word. What we use as a drill is we call it a handpiece. Kind of a silly way of describing it, but we call it a handpiece. So get me a handpiece. We never say get me a drill. Or you never say you're going to drill on a tooth. You always say you're going to prep the tooth. We're going to prep it. So that's kind of how we get around saying those ugly words.
Right.
And we never hurt. We never say hurt. We say discomfort. Try to. Of course, I'm catching myself. Does that hurt all the time? But we shouldn't say it because it kind of brings up
that connotation.
Yeah. So we try to tiptoe around it sometimes because our patients are conscious and they can hear everything we're saying, and so they pick up on that. So we're trying to deflect a little bit. So,
are there any procedures or many procedures where you put them completely under general anesthesia?
There are dentists that do that. There's only 2, I think, in the state that do it. I am going to talk. You brought that up. Somebody just sent me an email, and they're going to provide a service for that. So I'm going to talk to them. They live in Bardstown, so they might be rolling around to different offices, which would be good. I've tried to do it in the past, but there's only one dentist I know in Louisville that actually does that sedates them. Now the oral surgeons do. The surgeons will do it in their office. You have to have an RN there to do it, and then that's how they take the wisdom teeth out a lot of times.
Okay.
So,
but that's more just for comfort, not for necessity
yeah,
necessarily.
Yeah, exactly.
Okay.
It's just for comfort, just like you would in any surgery. The surgeons can still do the surgery without anesthetic, but the patients can't.
Yeah.
So that's kind of how it is.
So on your face there,
Yep.
we had the various different teeth. So some of them you said they're incisors, canines,
right.
molars.
Okay.
Which ones are?
You have 4 incisors across the front.
Okay.
It goes 10, 9, 8, 7 would be the 4 incisors, and incise means to cut. So they're the cutters. You know, they're not made to masticate. They're not made to chew. And people who lose their back teeth will chew with them and wear them down pretty fast. But the incisors. Then you have after incisors, of course, in the back. Everybody knows those are molars. We call those molars because of the mastication. That's how it gets its name. And there's 3 molars. So you've got here, we got 17, I'm sorry, this is 16, 15, and 14. These are the molars on that side. And then right before the molars, you have premolars, or bicuspids, because they have 2 cusps on it. So these are the bicuspids or the premolars. And then that one is the canine. Canine, I guess from a dog.
That's one more like
pointed. Yeah, when you see a dog growl at you, those are his canine teeth that we have, and we have them too. So we have 4 incisors, 1 cuspid or canine, 2 premolars, and 3. So the dental formula, I think we talked about that once before, is 2, 1, 2, 3. That's the dental formula of us, because we break it in half, the sagittal section in half, and that's how we do it.
Okay.
So I know it's kind of we went pretty fast here.
Yeah,
today, but
a lot of information.
A lot of people ask about what the numbers are, and they try to guess the numbers, and a lot of people figured out what we're saying, because guess what, 13 is behind 12. So yeah, it does do that.
It works out.
Yeah, it works out. But if you got them missing, then a lot of people forget that we are occupying that space.
Yeah.
Yeah.
Okay.
And the orthodontists use a different system than we do too. They will, instead of using that, they'll use a system where they say, I want you to take out. They tell us sometimes they want us to extract the 4s. The 4s would be all the first premolars, because they go from 1, 2, 3, 4. They count from the center back over. It's because all we're symmetrical. So we got an upper and a lower, and we're all symmetrical. You should be, and that's how we know the 4s are the premolars, the first premolars. So that's pretty common to say take out the 4s, and we just know where to go.
Yes.
So.
And this is why he went to school for a long time, to learn all this stuff. So that's a quick little course.
And all the girls know the language too. So we were talking today. As a matter of fact, Misty was just telling me that she and her husband, I told her what we were going to talk about today. She said she and her husband had the same discussion last night. So,
Really?
How do you know what you're saying? And so you just got to pick it up, just like any language.
Interesting.
Yeah.
There's always something interesting with Dr.
There you go.
Johnny
Yeah,
Isaacs at Isaacs and Isaacs General
we
Dentistry.
try to keep it interesting.
That's right. And we're on Bobolink Drive in Springfield.
Right.
And the phone number for people to call?
Phone number is 859-336-7680. 859-336-7680. Same phone number since 1963. My dad started this practice when I was a year old. So,
Wow.
So there you go.
Another number.
Right.
And we'll be back next month with some more information all about dentistry. It's been Gary White for Channel 6 Television.